So Gia is a dedicated academic currently pursuing a Master of Health Sciences. Currently pursuing a Master of Health Sciences in Medicine at the University of Auckland. Navigating a 6-year MBBS program, Gia withdrew in the 5th year and seamlessly transitioned to the honours of Bachelor of Health and Medical Sciences, earning a first-class honours. And she will speak to us today about psychosocial and health outcomes in young onset dementia, a longitudinal study on the impact of aged residential care admission in New Zealand. Over to you, Gia.
I'm Gia. I'm very honored today to share with you part of my master's project, Psychosocial and Health Outcomes in Young Onset Dementia, a longitudinal study on the impact of aged residential care admission in New Zealand. Sorry, but you have to bear with me for my hoarseness of voice. Sorry. Next slide, please. So I'll go through the introduction of what is young onset dementia, the research gaps have identified, the aims of this project, methods we've used, results obtained, and then the conclusion we've made. So first of all, what is young onset dementia? It was previously known as presenile dementia until about 10 years ago. Can you please press enter for me? Yeah, it was replaced by younger onset dementia, early onset dementia, younger people with dementia. Currently, young onset dementia is a term of preference to prevent misunderstanding between early stage of dementia and early onset dementia. Young onset dementia, sorry, back. Young onset dementia is conventionally thought to include patients with onset before 65 years of age. This cutoff point is indicative of a sociological partition in terms of employment and retirement age, but this age has no specific biological significance, but psychosocial significance. So here's some epidemiology of young onset dementia in New Zealand. Enter, please. Yeah. Ryan et al. Explored on the prevalence of young onset dementia in the whole New Zealand, while Fonseca et al. Looked into the incidence of young onset dementia in Waikato region. It is not surprising that age 45 to 64 population has higher incidence and prevalence than age 30 to 64. Ethnicity-wise, Maori has the highest prevalence and incidence than non-Maori, which is consistent with other findings where Maori and Pacific people have a higher burden of dementia risk factors. So after going through the literature on young onset dementia, which is pretty little at the moment, I've identified missing psychosocial enter, please. Psychosocial and health outcomes research in young onset dementia, particularly in New Zealand. So therefore, in this project, we aim to report the psychosocial and health outcomes of a young onset dementia cohort in Waikato before and after the admission to ARC, the aged residential care. So in this project, we are using the patient cohort from the incidence paper by Fonseca et al. Enter, please. Yeah. Which covers the Waikato District Health Board catchment area. They have included all inpatients aged 30 to 64 from Waikato Hospital with a coded diagnosis of dementia and outpatient referrals from the Memory Service, Intellectual Development Disorder Team, Neurology Outpatient Clinics, Mental Health Services for Older People, and one of the 4 private neurologists in the region. And they've identified a total of 64 patients who have met, who have met the inclusion criteria. However, we identified 3 unmatched NHI, 1 correct and 1 incorrect date of birth, causing the age of diagnosis to be 80 years old. So now we are down to 60 patients for this project. Enter, please. Yeah. We have access to interRAI assessments, including contact assessment, home care assessment, long-term care assessment, and palliative care assessment for all the 60 patients for at least 5 years post-diagnosis, which is up to the 31st of December 2021. Some of the responses from the interRAI assessment were recorded for statistical analysis purpose. Next slide, please. So we tried to compare the last home care assessment with the first long-term care facility assessment, but some had two assessments within days, which means we're too efficient. Therefore, to allow adequate time for patients to settle down in the aged residential care, we set the duration between the first long-term care assessment and the subsequent long-term care assessment to be 6 to 18 months. Enter, please. So the number of patients included in our final analysis is 29. Next slide, please. So here's the list of health outcomes compared. We'll only go through those with significant difference in the results section. Next slide, please. So here are some of the patients' demographics used. On the left in the black, those are a patient cohort without long-term care assessment during the 5 years of follow-up, while on the right in the blue, those are the patients who had long-term care assessment, which means they were admitted to an aged residential care during the follow-up. We can see that the age of those admitted to an aged residential care, the range and mean are higher than those not admitted, and the difference is statistically significant. Gender-wise, more females were admitted, which is consistent with the current literature, but it is not significantly different here. Oh, sorry, enter, please. Yeah, so that's the p-value. So age is statistically significant, and the others are not. And next slide, please. So health outcomes wise, changes in health and stage disease signs and symptoms, which is a scale used to look for the frailty and health instability and identifies a person at risk of serious decline. So smoking, chairs, and hospitalization within 90 days improved are statistically significant, which are good signs. Next slide, please. Psychosocial-wise, more patients reported without loneliness after institutionalization. However, we can see that the p-value, it is lack of significant value, statistically significance, which might be attributed to the small sample size, highlighting the importance of conducting further studies with larger cohorts. So this is the first, as I said before, we haven't had anyone compared health outcomes in New Zealand, while this is also the first globally to compare health outcomes before and after institutionalization. And it is encouraging to observe improvements in some aspects of well-being in people with young onset dementia following aged residential care admission. Next slide, please. I'd like to acknowledge these people, so Gary, Bridget, Claudia, and Itu, for if without their help, I wouldn't be able to finish my master's. Thank you.